Hi everyone, welcome to our channel. In this video, I will talk about the carpal bones. I have divided the video into several parts. First, I will talk about the names of the carpal bones, then the site determination with specific points, next the attachments, the articulations, and last the clinical. And the end of the video, I will say you the important question your examiner will ask. So let's start with the carpal bones. Carpal bones, as you know, we consider the carpal bones as the wrist bones. So we have 8 carpal bones. From lateral to medial, it is divided into 2 rows. Proximal rows, this is the proximal rows, and here this is the distal rows. In the proximal rows, we have from lateral to medial, we have first the scaphoid bone, then the lunate bone, then the triquetral bone, and above the triquetral bone we have P-shaped bone, that is the pisiform bone. Next, again in the distal rows we have from lateral to medial, first we have the trapezium bone, then the trapezoid, then the capitate, and next the hamate. Capitate is the capitate is the biggest bone in the wrist bones. Okay, so these all are the bones which your examiner will ask to name and nothing else. If you get the carpal bones, then it will be fixed like this. But by chance, if you get the bones separately, then how you will identify that which bones is what? So let's go through that. Next is the site determination with specific point. So the scaphoid bone. How we will identify the scaphoid bone? The tubercle is directed laterally, forward and downward. The lunate bone, a small semilunar articular surface for the scaphoid is on the lateral side. And next is a quadrilateral articular surfaces for the triquetral is on the medial side. Two facets you can see in this bone. Now next, if you get the triquetral bone, first feature is the oval facet for the pisiform lies on the distal part of the palmar surface, and next the medial and the dorsal surface are continuous and non-articular. If you have the pisiform bone, then first you can identify with the P-shaped, but the several points are the oval facet for the triquetral lies on the proximal part of the dorsal surface, and next is that lateral surface is grooved by the ulnar nerve. Next, if you get the trapezium bone, then first is that the palmar surface has a vertical groove for the tendon of the flexure carpi radialis. Second point is that the groove is limited laterally by the crest of the trapezium. And number third is the distal surfaces bears a sellar concavo-convex articular surface for the base of the first metacarpal bone. If you have the trapezoid bone, then the distal articular surface is bigger than the proximal. Next, the palmar non-articular surface is prolonged laterally. Now, if you get the capitate bone, then the dorsomedial angle is the distalmost projections from the body of the capitate. It bears a small facet for the fourth metacarpal bone. And at last, if you get the hamate bone, it is hammer-like structure. You can see that it has a hook in it. So the hook projects from the distal part of the palmar surface and is directed laterally. So this all are the points you have to remember before identifying this each and every bones in the carpal bones. So now here let's talk about the attachments. There are 4 bony pillars at the 4 corners of the carpus. Okay, what are the 4 corners? Here this is the scaphoid, and then there is the scaphoid. This is the scaphoid and the trapezium. Next is the hamate and the triquetral. So these 4 are the corners of the pillars of the wrist bone. So first we'll talk about the attachment in the scaphoid. So scaphoid bears a tubercle. Okay, laterally. So scaphoid has the attachment of the flexure retinaculum and a few fibers of the adductor pollicis brevis. Next, the attachment in the pisiform bone. In the pisiform bone, the insertion to the flexure carpi ulnaris and the flexure carpi ulnaris, and you know that the pisiform is a sesamoid bone over the flexure carpi ulnaris. Then it has the attachment of the flexure retinaculum and its superficial sleeve, and the abductor digiti minimi and extensor retinaculum. These four are the attachment of the pisiform bone. Next, the attachment in the trapezium bone. In the trapezium bone, the crest gives the origin to the abductor pollicis brevis, flexor pollicis brevis, opponens pollicis, and this constitute muscles of the thenar eminences. And the edges of these groups gives attachment to the two layers of the flexure retinaculum. And next, the lateral surface gives attachment to the lateral ligament of the wrist joint. The group lodges the tendon of the flexure carpi radialis. Okay, now the attachment of the hamate. Hamate has in the tip of the hook gives attachment to the flexure retinaculum. The medial side of the hook gives attachment to the flexure digiti minimi and the opponens digiti minimi. Now from all these four attachments, you can see one thing is common, that is flexure retinaculum is common between all the attachment of the four bones. So what are the articulation? Articulation means which bone is related with which bone. So first we'll talk about the scaphoid. Scaphoid, as you know, is related with the radius because here radius bone will lie. So with the radius, with the lunate bone, with the trapezium bone, with the trapezoid bone, with the capitate bone. Okay. And next is the lunate. Lunate is related to the radius, the scaphoid, the capitate, the hamate, and the triquetral. So this is the hamate and this is the triquetral. So it is attached with all these bones. Next, the triquetral. This is the triquetral bone and it is related to the pisiform, of course. Then is the lunate, hamate, and the articular disc of the inferior radioulnar joint. The pisiform bone it articulates only with the triquetral bone. As you can see, it is not related to any other bone, only with the triquetral bone. Okay. Next, with the trapezium bone, it is related with the scaphoid bone, the first and the second metacarpal bone, and then the trapezoid bone. Trapezoid bone. Yeah. Then the trapezoid. Trapezoid is related to the scaphoid, the trapezium, second metacarpal, and the capitate. This is the capitate. Now next, the capitate bone is related to the scaphoid bone, the lunate bone, the hamate bone, and the second and the third and the fourth metacarpal bone and the trapezoid bone. Last is the hamate. Hamate is related to the lunate, triquetral, capitate, fourth and the fifth metacarpal bones. So this all are the relation with each and every bones. This articulation you have to learn. So these all are the articulation part. Next, moving on to the clinicals. The fracture of the scaphoid is quite common. The bone fracture through the waist at right angle to its long axis. The fracture is caused by the fall on the outstretched hand or on the tip of the finger, and this causes a tenderness and swelling in the anatomical snap box. As you know, I will keep a video on the anatomical snap box. Okay, so this causes a damage to the anatomical snap box and pain on the longitudinal percussion of the thumb and the index finger. Next, you have to know that the scaphoid bone has two nutrient arteries, one entering the palmar surface of the tubercle and the other in the dorsal surface of the body. Occasionally, in 13% of the cases, both vessels enter through the tubercle or through the distal half of the bones. In these cases, if the fracture happens, then what will happen? There will be vascular necrosis. Okay. Next, dislocation of the lunate bone. This is the lunate bone, and this happens very frequently. The dislocation of the lunate may be produced by the fall on the accurately dorsiflexed hand with the elbow joint flexed. This displacement this displaces the lunate bone anteriorly, also leading to the carpal tunnel syndrome like features. So these two are the clinicals. So the important question your external may ask are, first, the name of all the bones specifically you have to know. The attachment you have to know. What type of bone is a pisiform bone and any other example of that bone. So these all are the things your examiner will ask. Okay. Thank you.